Hey guys, Cody Warner at Idaho Medical Academy. Today we're going to be going over the oxygen administration and the airway management skill sheet video. First, we're going to take you through step by step on that skill sheet, explain all the steps and show you the how-tos. And then we'll actually run a student through a test so you'll get to see what a testing scenario looks like. So let's get started. All right, you guys, let's go ahead and go through that skill sheet step by step, and I'll explain in detail each step as we go along. So first things first, we want to make sure we have our PPE on and that our scene is safe. At this point, your proctor is going to give you a scenario, and then you can start the skill sheet from there. So like I said, we're going to gather all of our equipment. Okay? I'm going to take my oxygen tank. I'm going to take my wrench. I'm going to go ahead and open up and crack the valve. All right, this lets me know that I have pressure in the tank, and if there's any debris, it's going to kick that debris out. Then I'm going to set up my regulator. I'm going to make sure these two prong holes line up with the two ports that they're going to go into. Place the prongs in, and then I'm going to tighten down my regulator. So right now I have no oxygen flow, so I'm going to open up my oxygen tank. And as you can hear, I do have a leak, so I'm going to take my wrench and go ahead and tighten that down. Okay, I'm going to make sure that I don't have any leaks and that my pressure is full. Right now we are at 2,000 PSI. We're going to replace these at 500 PSI. Okay. I'm going to lay down my tank, and at this point I now have to set up my oxygen delivery device. Your proctor is going to give you an SpO2 reading, and you're going to make the decision whether you want to use a nasal cannula or you want to use a non-rebreather. Typically anything under 90%, we're going to go straight to the non-rebreather, and I'll show you both. So with the cannula, we're going to open it. It is your job to know what your flow rates are. So for a nasal cannula, anywhere between 1 and 6. I typically like to start a cannula at 2 liters per minute. So I'm going to place it on the port. I'm going to open up my regulator, and it will give me a number. And right now I have it at 2 liters per minute. Lay that down. I'm going to place this on my patient's face. So with these nasal cannulas, you'll have a small tab, and then these two little ports will go into the nose. With this, we don't want this going over the head and wearing like a necklace. So we don't want something like this. Okay. We're going to place this tab down into our patient's nose and then around their ears, and then we can tighten it just like that. Okay. So when I'm placing it on my patient, I'm going to place it into their nose and around their ears, and then I can tighten it to their face. Again, if they're between 90 and 94%, a nasal cannula will do the trick. Okay. For your test, you're probably going to get something under 90%. And so you would then move to the non-rebreather. Okay, a non-rebreather mask, again, make sure you know your flow rates. These are flowed at 10 to 15 liters per minute. So I'm going to attach my oxygen. I'm going to place this at 10. If you do 10, 12, 15, you are correct. So before I place this on my patient's face, I'm going to inflate this reservoir bag. Your patient will suffocate if you don't inflate this reservoir bag. Okay? Best practice is to place it on their face, and then you're going to put the strap around their head. So I place it on my patient's face, over his nose, under his chin, and then I'm going to take that strap, run it behind his head and over his ears. To make sure it fits snugly, I'm going to pull on these straps, and then I can use the metal brace on top and cinch it down to his nose. So that's the oxygen delivery portion of this test. Now that you've got this on, your proctor is going to tell you your patient becomes unresponsive. Okay? From there, once I hear as soon as they're unresponsive, I'm going to go ahead and request additional ALS. Okay? And if my patient's unresponsive, just like in the field, I'm going to check for a pulse for no more than 10 seconds. I'm going to look, listen, and feel for any breathing. Okay? That point, your proctor is going to tell you that your patient has a weak carotid pulse of 60, but they're apneic, meaning they're not breathing, but they have a pulse, therefore I don't have to do CPR. So I'm going to ventilate this patient. Okay, before I do that, I need to open up the airway and assess their airway. Okay, if I'm not worried about C-spine, something as simple as a head tilt, chin lift will open up my airway so that I can visually inspect it. If I am worried about C-spine and I don't want to compromise the neck, I'm going to do a jaw thrust. Jaw thrust, I'm going to take my palms, put it on their cheekbones. I'm going to place my fingers at the bottom of their jaw and lift it up towards me. Then I'm going to take my thumbs and push out their lower jaw so I can actually look into the airway. Okay, for this guy, head tilt chin lift is going to do just fine. Now I'm inspecting the airway. If I start bagging this patient with fluid in his mouth or vomit or other secretions, I'm actually going to be pushing it into the lungs. That's not good for our patient. So at this point, your proctor will tell you notice vomit and secretions in the airway. Your job is to suction that out. So now that I know my patient has vomit and secretions in his airway, I want to suction. So I'm going to turn on my suction. For the video and demonstration purposes, I'll leave it off. But I want to test my suction, okay? So I'm going to place it against my hand. I'm going to occlude this hole to test the suction. Newer catheters might not have that hole to occlude, so all you got to do is put it up against your hand. You will not be suctioning your patient unless you occlude that hole, okay? So I'm going to go into the airway, and I'm only going as far as I can see, okay? Once I'm into the airway, I'm not applying suction until I'm at where I want to be at. Then I'm going to occlude the hole and suction on the way out. We can suction in a zigzag formation or a circular motion. What we don't want to do is just sit here and suction. We don't know what's going to get stuck on the end of the catheter. So place it, start suctioning, and suction on your way out. The skill sheet says to do this for no more than 15 seconds or until the oropharynx is clear. So with that being said, you're going to suction, and once your proctor tells you the oropharynx is clear, you can then turn off your suction and put your catheter back. Okay, now that you have an open airway, you want to place an adjunct into your patient to help them breathe. So we have two options. We have an OPA or an oral pharyngeal airway, and we want to measure it before we place it. These come in all different sizes. So we like to measure OPA from the corner of the mouth to the bottom of the jaw. Again, if it's really small, your patient could choke on it. If it's too big, it's going to stick out of their mouth and we're not going to be able to actually bag the patient. So we want to measure it. With my patient's airway this open, I'm going to go at a 90-degree angle and kind of scoop the tongue. Okay, you want this to sit in the airway just like this, not backwards. Okay, we're keeping the tongue off the back of the airway. Some people will also do a full 180-degree twist, and some people will also do a thumb and finger scissor technique, where they'll actually open up the mouth. That way if your patient bites, you can quickly release. So go ahead and open it up. I like to go 90 degrees, make sure I scoop the tongue. Now if my patient is gagging or biting it, this means they're not accepting. So I want to remove it because I don't want them to vomit. Your proctor will tell you your patient accepts the airway or they do not accept the airway. The other adjunct we have is an NPA, or a nasopharyngeal airway. This one's gonna go into the nose. We also have to measure this as well. So I like to go from the bottom of the ear or the center of the ear to the nose. Again, if it's too big, it's not gonna fit. If it's too small, we're not actually gonna be passing air through it successfully. So when placing an NPA, one side will always be beveled. We want that bevel towards the septum. So I'm gonna place it just like this. The other thing we have to do is lubricate these. So in your jump bag or on your ambulance or on your fire engine, we should have little packets of lubricant. Place a little bit in your hand and lubricate it because we don't want to cause them to bleed. Okay, sometimes these can be a little difficult to actually place into your patient's nose. So we're gonna go bevel towards the septum. And one thing we see a lot is people will try to go up towards the forehead to try and get that curvature of the nasopharynx, but really, once you place it in, it's kind of more of a straight down. You can kind of twist. This is not something we want to force. On the rubber mannequin heads, it's a little more difficult. But with actual people, we want to go ahead and place straight down. It shouldn't be super aggressive. The other thing is if we're going to place it into the other nostril, we have to turn it 180 degrees. So bevel towards the septum, so right now it's backwards, and we're going to go ahead and twist it in to that nasopharynx. Okay, again, this one's rubber, so it's a little difficult. So yeah, your patient, again, if they accept it, your proctor's going to tell you. For your test, you only have to use one or the other. Okay. On an actual patient, I do like to do an OPA and 2 NPAs because it really helps open up that airway so we can bag this patient better. Okay. So my proctor tells me your patient accepts the airway adjunct. So now I can begin bagging. Okay. So I'm going to take off my non-rebreather. I'm going to place it to the side. I'm going to take my BVM. Should already be hooked up to oxygen tubing, but if it's not, you're going to take your oxygen tubing and you're going to place it on the back portion of the BVM. We also have a port here, and this is just to fill up this mask. A lot of students will try to put the O2 here. This is not getting your patient oxygen. This is just to inflate the mask so you get a better seal. So you want to place it on the back. Okay. With BVNs, we only flow these at high flow. 15 liters per minute is just enough. Some regulators will go up to 25. If you want to put it at 25, you are not incorrect. As you'll see, is this bag will also inflate. This is just a reservoir bag. We do not need to fill this up before we deliver a ventilation. Okay. So when giving a breath, and I'm going to turn off the oxygen for demonstration purposes because it's a little noisy. But we're going to keep that at 15 liters per minute. Now, placing this on our patient's face, this mask is very specific. So this kind of top of the triangle portion is going to go on the nose. The bottom part is going to go on the jaw. I like to use an EC technique. So you take your 3 fingers, you make an E, take your other 2 and make a C. C goes on top, place it on the patient's face, and my E, my bottom 3 fingers are going to grab the jaw and pull the face into the mask. Okay? Getting a one-handed seal is very, very difficult on actual patients. With the mannequin, you can get it done, but on actual patients, it is a little difficult. So something in the field you'll see a lot is a 2-handed seal and basically a jaw thrust into the mask. But for your test, you're going to be all by yourself, so make sure you practice getting a good one-handed seal. And then we're going to go ahead and deliver a ventilation. When squeezing the bag, it's nice and smooth. We don't need to squeeze it super hard and force a bunch of air in. It's most likely you're going to bypass the trachea and go straight into the stomach. Okay, so make sure we're practicing good habits. We get a good seal, and we're going to do a nice smooth breath. Okay, you're going to deliver a ventilation over 1 whole second. Okay, you're going to be giving a breath every 5 to 6 seconds, which is 10 to 12 per minute. Okay. One thing we see in practicing and in testing is you say that, but you're doing this because you're nervous, test anxiety, so make sure we're practicing good habits. A lot of people also, this is very comfortable to have their hand on top of the bag. This is how we can force more air and not really focus on how many breaths we're giving. So I like to put my hand underneath because it's a little more uncomfortable, and that way I can actually focus on delivering breaths. Okay. So over 1 second, 1 1,000. 2 1,000, 3 1,000, 4 1,000, 5 1,000, and give a breath. Okay? It's going to feel really, really slow, but that's okay. That's what you should be doing for your patient. And then your proctor is going to ask you something like, how do you know you're giving adequate ventilations? And you're going to tell your proctor you're looking for bilateral chest rise, meaning not one side is raising while the other isn't. We want both these lungs to fill up. You're also going to tell them you're looking for oxygen saturation to be climbing or maintaining above 95%. And another sign we could look for would be skin signs, returning from blue or cyanotic back to pink. And that's how we would know we're delivering adequate ventilations. And that would be the end of your test. Okay, Chris, this is your airway management oxygen administration skill station.
All right.
You got all your equipment here. Your patient is a male patient complaining of shortness of breath.
Okay.
Upon arrival, he's tachypnic, has perioral cyanosis, and an oxygen saturation of 78%.
Okay.
And you may begin.
Thank you. All right, so first things first, I will ensure I have my BSI precautions taken care of. I'm wearing my PPE. First thing to do is gather all my equipment. It's all here already for the testing station. Looks like we have everything I'm going to need. Next, we're going to get our O2 bottle set up. So I'll grab my O2 bottle and my oxygen key here. I'm going to open this up, clear debris, ensure that we have oxygen in the cylinder, which we do. Debris should be clear. Next, I'll grab my regulator, and we will place the regulator. So slide it down. We'll match up the little posts here, and we'll tighten down. Make sure it's nice and snug. I'm gonna open up to check how much O2 we have. We're showing is full. I'm also gonna check for leaks. I don't hear any leaks, so we're good to continue on with the scenario. Based off of what you told me, I think this patient needs to go beyond just the nasal cannula because of the SpO2, as well as the skin signs and other indications that you've given me. So we're going to jump right to the non-rebreather mask. I'll take my non-rebreather mask. We're going to plug this in here. Flow rates for a non-rebreather are going to be between 10 and 15 liters per minute. So we'll put this at 10. Before placing, I will ensure that my bag is nice and full. My bag's full, so we're going to go over the face here. We'll start up on the nose, make sure we have a good seal around. We will put the strap on the back of the head, secure that, and then secure the bridge of the nose to ensure we have a good seal.
Perfect. You now notice your patient has become unresponsive.
Okay, so my patient's become unresponsive. Due to the change in mentation, we need to do a primary assessment. I will also call for additional EMS. Let's get an ALS ambulance or ALS partner, whatever, en route to me here. So I'm going to check for those ABCs again. I'm going to stop this and pull it off just so I can visualize the patient's airway. I'm going to come down, I'm going to look, listen, feel, and check for a pulse for at least 5, but no more than 10 seconds. What do I find when I check my ABCs?
Okay, so your patient has a weak pulse of 60, but they are apneic.
Okay, so patient has a pulse of 60, which means there's no required CPR at this point, but my patient is apneic, so I'm going to need to ventilate for the patient. First thing I'm going to do is a head tilt chin lift and visualize the airway. How does the airway look?
You notice it's full of vomit and secretions.
Okay, so we need to suction that out. So I'll grab my suction device here. I will ensure I have a catheter. This is a Yonkauer rigid catheter. We have that all set up. It's plugged into my suction device. We're going to turn the power on. And I will verify I do have suction. It's here. Okay, we have suction. So I'm going to come in only as far as I can see with the suction off. Once I go as far as I can see, start my suction. I'm going to do kind of a circle as I suction out for no more than 15 seconds for an adult patient.
All right, your mouth and oropharynx are now clear.
Okay, so my mouth and oropharynx are now clear. So at this point, I want to place some sort of airway adjunct. Based off of what we've seen, I want to attempt to place an OPA first. So again, ensure my airway is open. I'm going to measure from the corner of the mouth to the corner of the jaw or the ear. This looks to be the correct size. So I'm good there. I'm going to open the airway and I will do a 90-degree turn. So start here, go until I meet that resistance at the back of the mouth, and I'm going to turn. Does my patient accept my airway adjunct?
Your patient accepts the airway adjunct.
Okay, so we have our airway adjunct placed. That has been accepted. So now it's time to move over to my BVM. So I will unhook my non-rebreather. We're going to place our BVM on here, and I'm going to turn this up to 15 liters per minute. I'm going to come with my BVM. We're going to go over the bridge of the nose, around the mouth, do my good CE technique, and I'm going to pull the face into the mask so I'm not smashing the face down. And then I'm going to give it one breath every 5 to 6 seconds, looking for chest rise. So give one breath. 1, 2, 3, 4, 5. Breath.
How would you know you're delivering adequate ventilation?
4, 5. Breath. I'd be looking for bilateral chest rise and fall. I would be checking for an increase in SpO2, as well as looking for skin signs to become more normal to get rid of that cyanosis.
Perfect. Thank you, Chris.
All right. Thank you, Cody.
Okay, guys, that was an example of a student going through the test. One thing I want to point out is if you notice, Chris verbalized every single thing he was doing. So if you were reading along with the sheet, you notice he went in order, step by step, word for word. That is how you're going to be able to crush this test. If he showed up and didn't say a single word and did the whole thing just with his hands, you might not get a pass because the proctor is actually looking down at that sheet. So whatever you don't say, you're not going to get a point for. So make sure you're studying, and if you have any other questions, please give us a call or visit us online or check out our YouTube channel. Thanks and good luck. Freaking still got it.
Still,
He still got it.
Let's go.